So yeah, so I was talking about school. So I'm very happy that the schools are doing an online thing, but you have to realize that the virus SARS-CoV-2 is going to be with us for some time. Different authorities on the subject have different time zones that they are talking about, time limits and stuff like that that they are talking about. I don't want to comment on that, but we are going to have to learn to live with this virus for some time till a vaccine comes out and all of us get vaccinated. So till then we have to learn to live with this. I don't know when the schools will start, but I don't think so they will start till we have things more under control. But if they do start, then we have to teach our kids about social distancing and how to take care of themselves and how to not behave. I will come to that when I talk about educating our kids. The other thing I want to talk about is hygiene. You know how in your office and at home, how you are going to take care of all these surfaces which I spoke about, which are high contaminating surfaces, high contact surfaces. So how you will take care of, make sure that these are clean and they do not become places where you are spreading the infection, and that is by using something called as sodium hypochlorite. Sodium hypochlorite is a chemical which you can use in 1-part solution. What do I mean by a 1-part solution? So basically, simple terms, 10 ml in 1 liter of, you take your 1 liter of water, add 10 ml of this solution and you shake it up nicely, and that is basically good enough. And you can use this for swabbing the floor in your house, make a cloth wet in this kind of a solution and use it to clean the knobs of the doors in your house. The people, your workers, the people taking care of sanitation in your offices should also be given these solutions so that they can spray it and just clean things around. And your table can be taken wiped with that, the surfaces. So that's how you can make sure that you clean these surfaces with this kind of liquid, and you can clean them regularly and make sure that everything is clean around you. Now you have gone to the market, you have stepped out, gone to the market, you have gone to work, and now you're coming back home. So when you come back home, this is another very important step, because even though, in spite of taking all the precautions and care that you have taken, you could be bringing something back. So how to make sure that even though something is on your clothes or on your mask or on your hands or anywhere, you don't transmit it to anybody or any surface of your house. Simple steps, very easy, nothing to get scared of, nothing to worry about. Things you need to do once you step in. So there are some things that you normally carry with you: your keys, your mobile phone. I'm sorry, I'm not showing my phone now because I'm on my phone now. So your mobile phone, simple thing as a pen which you keep on you when you go to the office, so a pen, stuff like that. So before you step into the house, at the door, you place all these things in a plastic bag and you seal the bag and you keep it just inside. You have a table where as you step in you can keep it there. Your shoes you remove and your socks you remove, hold them in your hand, and you walk straight without touching anything. No need to have a conversation and stand in the middle of the house or in the hall and talk to someone about your day or any of the family members. Do not do that. Walk and straight go to the bathroom. Once you are in the bathroom, you make sure that there is a bucket that has water, put soap liquid into it, and then the socks that you had in your hand, you put it in there. Then when you're removing your clothes, very important that you remove your pants and undergarments first, and once you've done that, place them in that bucket again. The and when you're placing these things in the bucket, very important that you immerse your hands in that bucket also, because at the same time your hands are getting sanitized as you're putting it. What is very important is how you remove your shirt. If it's a shirt, it's easier because you just unbutton yourself completely and then remove it this way and put it into the bucket. But when it is a t-shirt or something of that sort which you have to remove over your head, that is something which is of concern. So I have some special instructions for that. So when you're removing a t-shirt, you spread it from here. You hold this area, spread it, okay, bend down and forward. Okay, before you move it, take a deep breath, stop breathing now, move ahead, remove it over your head, and the best way to do it is once it's out here, then turn it and then remove it straight like that, so it comes out in the reverse fashion, not the straight way, and it's out from the head in the straight way, and then the rest of it comes out in the reverse fashion, then put it directly into that bucket that you have prepared to put all your clothes and undergarments in. Once it is immersed completely, that is safe enough, and if you have any virus on that, that has been taken care of and that threat has been neutralized. You place the bucket in the corner, that can be washed later. Remember, you have immersed your hands, so your hands are now virus free. But the other area that you have to watch out for is your face and your head. So what I recommend is if you're using a shower or a bucket with a mug, there are two things that people do. If it's a shower, very easy, put on your shower, make sure that your shower is taking care of your head and your face is getting wet. You take your shampoo and not only scrub it on your hair, but what I recommend is your neck, entire neck, and shampoo. Use the shampoo to just scrub everything and then rinse it away together, so that this area is cleared and done with, and anything that could have been in that area is taken care of. Then you can take your normal bath with the rest of the body, and make sure that each and every area is basically covered with soap and water, and you washed it thoroughly, and use hot water. That's another good thing. So these are, and then obviously come out, wipe yourself, and you can wear your normal clothes. Then you can put that what you have in your bucket into the washing machine and wash it with the rest of the clothes. That's not a problem. And another good thing that you can do is take steam inhalation for some time after you come back from outside, so that you're feeling safe here when it comes to going and hugging your kids or your parents or your loved ones, anyone that you think of. Having said that, there is one more thing that is still left, is that bag that you had put over there, which contains all your keys and your pens and your mobile phones. Now those things need to be sanitized. So sanitization with a mobile phone, Tabis, can I have that? Sorry, I need a phone to show you. So sanitization of a mobile phone is very important. So you have a mobile phone, and most of us have covers. So this cover is also required to be sanitized, because that's what comes into contact. So your cover and your mobile phones both need to be sanitized. Using a liquid alcohol based sanitizer is the way to do it, making sure that the inside of these cover and every surface, you douche it in that. You don't need to dip it in that. You just have some on your hand, and you make sure that you rub it very nicely and cleanly, and then let it dry there. The same thing goes with the phone. Do not worry if your phone is not water resistant or waterproof. It is not going to create a very big problem with your phone. You just need to do it, wipe it with an alcohol based sanitizer and make sure that you dry it before you use it. The same thing will go with your pens, with your keys, that you use these alcohol based sanitizers to sanitize all of these things, be it your pen, be it your keys. The keys, just take alcohol based, keep your pen in on your palm and just a few drops of that alcohol based sanitizer, and using that in this manner, going through every surface that you come into normally contact with, and you can just do that and make sure that you have sanitized it, sanitize your phone properly, and then you can remove it from that. So you remove it from that bag and you do all of this, and you have taken care. And that bag is zipped again and put in that same place, so that whenever someone comes in, that is the bag they use. Now another thing, you've come home and you were wearing a mask, right? Either this or either this. What do you do with this mask? That is something that is very important. So you again need to have a Ziploc bag where the masks are kept, and when you enter the house, you remove it. You can put that mask in that bag and seal the bag so that no one else touches that. And you have these small bags, Ziploc bags, which you can all have one big bag where everyone puts their this thing, but it would be better if you have the smaller bags and every individual puts their particular mask in that particular bag. Can I reuse masks? Yes, you can reuse masks. They can be reused. That's not a problem. You also get washable masks which can be washed and then reused again. But typical these N95 masks that are there, they can be reused. There is a protocol that we follow, but that's for hospitals and for us in OPDs where we see patients of COVID-19. So that's a different protocol. When it comes to you can reuse these masks. That's not a problem. The way to clean these N95 masks, if you want to, is using an alcohol-based sanitizer and just rubbing your hands on this. And you can also, this inside surfaces here, they can, and then letting it dry there is a way to do it. When it comes to these masks, the same thing, just very little amount of alcohol-based sanitizer, and you can just do that. Don't make sure it doesn't get wet, because once you get wet, then the integrity is compromised, so then that mask is not good. And these masks are good enough, that they're not very expensive also. If you want to use and throw the mask also, that's absolutely fine. But when you do throw the mask, make sure that you throw it in a bin with that has a plastic bag in it, and so that the person who's cleaning your garbage, who's taking away your garbage, does not come into contact with him. We have to think about them, because they are doing a very important job of making sure that our societies and are clean, and by taking our garbage away. So we got to make sure that we do our part rightly, so that they do not fall prey to our mistakes. How many times do I wash my hands? When do I wash my hands? So if you're at home, washing your hands with just soap and water is good enough. When you're outside, obviously using a alcohol-based sanitizer, because you might not have the facility. Before you prepare a meal, you should wash your hands. Before eating a meal, you should wash your hands. To mothers who are breastfeeding, before they breastfeed, they should wash their hands very nicely. If you're preparing a formula for an infant, you need to do that. When you're caring for someone who's ill, you need to, every time you go to that person and you need to do something with that person, you need to wash your hands before and after. Whenever you're treating a wound that is cut, a small cut, whatever happens in the house, you need to make sure that your hands are cleaned properly. Whenever you're brushing your teeth, anything you need to do in this area, you need to wash your hands before you do that. How do you wash your hands? That's a very, very important part, and I want to show you right now how you can wash your hands. So whether it be an alcohol based sanitizer or whether it be your soap and water, This is how you wash your hands. You take either soap or sanitizer here. If it's soap, then you will obviously be taking some water also. So the first thing you do is this, okay? First thing you do is this, and if the reason you're doing this is because if it's a soap water, you're creating enough froth and making sure that there is enough froth over here. You're doing this. Then you are going to spread these hands and do this. You see what I'm doing? My fingers are interlacing. So this is what you do. Then what you need to do is this and this, okay? So you are covering from your wrist onwards, you are covering all of this, okay? And you have done that. Then what you need to do is this. See what I am doing is to make sure that from the back side also, so two surfaces over here and over here, everything is taken care of, this. Then what you have to worry about is your nails. So underneath your nails you need to clean, and how do you do that is by doing this and this. What is left is your thumb, so with your thumb also you do this and you do this, and the other thing is doing this and this. The other way of doing it is this and this. So what happens is when you do this and this and this and this, you are taking care, and then turning it around over here, because that's another surface that is left. When you wash your hands in this particular way, you are making sure that every part of your hand is washed properly, correctly, and whether it be alcohol based sanitizer or soap and water, no matter what it is, you are taking care of your hands and they are washed properly. So that is about washing hands. I've already spoken about the mask. Make sure your immunity is up, and how you do that is by eating a healthy diet, making sure if you're eating meat, making sure that your meat is well cooked, your vegetables are washed well. If you're into eating salads, then you need to make sure that your vegetables are really washed well, and using vinegar, a very diluted form of vinegar, and soaking your vegetables and your fruits in that really helps in cleaning them up and making sure that they are disinfected, so that you can consume them raw if that's what you are into. Exercising every day at home. You can go to the various channels which are available and see these videos and follow those videos. Making sure you drink enough water regularly, and if you are meditate for some time every day, so that even mentally you are stress free. And something that is very, very important is making sure you get 7 to 8 hours of good sleep, so that you are very relaxed mentally. Try to make sure that you have a good daily routine where you exercise daily, talk to people in the house, talk to friends on WhatsApp or however you like to, so that you have a more normal day, so that you're here normally. Mentally also, eat food at regular time, exercise at a regular time. Make sure you follow a timetable so that your life feels normal, so that you will feel normally. Mentally also you will feel better about yourself and everything that is happening around you. Now the last part is not going to take long. I just want to talk about our little ones, because as much as this pandemic has affected all of us, our little ones are in a phase of life where they do not understand what is happening, and they don't know why they are at home 24/7, why they cannot go out and play, why can't they be with their, go to school, be with their friends there, or in your building and in your society, why they can't go and have sleepovers or parties, birthday parties. And I think we should educate them. We should tell them about the COVID-19 pandemic, which has engulfed the whole world. Don't give them that too much of a bad vibe, that about death and stuff like that. But you can educate them about how scientists are doing research on this, and how people are getting cured, and how we should take care of ourselves, and by staying at home, not going out unnecessarily by taking care of hygiene, by taking care of hydration, and by making sure you're eating a lot of fruits regularly and good healthy food. You can beat this, and then probably once we get a vaccine, we can go back to a normal life rather than a new normal. We can go back to a normal life where all of us across the globe are immunized against this SARS-CoV-2. We can do a better, have a more healthier, normal life, and the kids can go back to school and the playgrounds and everything. So to talk to them on a regular basis, ask them what they feel, ask them what they're thinking and how they're feeling about these things. So these are the topics I wanted to talk about. I'm done talking about with most of them. I just want to talk about some of the things which are available in the market to boost your immunity. So vitamin C is something that you should be having. Zinc containing vitamins, multivitamin tablets is something you should be having. Vitamin D supplementation is something that you should be taking, but please talk to your doctor regarding this, and because he knows you best, and when he tells you that you should be taking this, that is the time you should be taking this, and at the dose that he thinks that is appropriate for you, you should be taking this. I also would be putting up videos and posts on our various social media networks, be it Facebook, be it Instagram, or our YouTube channel, where we have videos regarding how to wash your hands, how to do social distancing, how to wear a mask, what are different types of masks. So if you've missed this session, you can see it over there. And thank you for listening. I hope this has given you information that gives you the confidence to go out when you start going out to work, and you maintain these things, and that hopefully that saves your family from getting infected or getting any kind of a problem. I will now go. Thank you, Shehzad, that's very sweet of you. There are lots of thank you. There are lots of people who are here, I think so. So Mr. Ashraf Ansari has asked, sir, using a mask for a long time can cause a lack of oxygen, please guide. That's a very, very good question, Ashraf. Thank you for asking that. So that's why when I spoke about the mask, I said you cannot do any strenuous activity like going for a long walk or exercising with a mask, because then your requirement for oxygen goes up, and then it becomes difficult for your body to maintain the oxygen level that it needs to, which is then it becomes dangerous for you, and that can cause dizziness or even fainting spells because the oxygen percentage in your blood goes down. Having said that, going out and going to office, using your transportation to go to office and sitting in the office and working on a laptop or however you do sitting down, that's not a problem wearing the mask. Then the oxygen levels don't go down. Your body is good enough, has good enough oxygen to maintain. So yes, do wear a mask, because it's very important, because if you contract something, then your oxygen levels will definitely drop, and that will not be good. So do wear a mask, but yes, do not do strenuous exercises when while wearing a mask. So that can cause a problem. Thank you, Hermione, for those comments. There are a lot of people, there are a lot of comments. I might miss you. So thank you for all your comments, and thank you for watching. If there are any more questions that you think about later, feel free to go to our Facebook page and put your questions there, and I will find the time to answer those questions. And I think there's one more question. I will take it. Okay, so Shehzad is asked, he's a doctor, so he's asked me that if patient enters his clinic and the patient is wearing a mask, and then when he checks the SpO2 levels of that patient, SpO2 levels might go down because the patient is wearing a mask. Shehzad, if the patient is healthy and does not suffer from COVID-19, that should not happen. If the patient is well rested and he is wearing a mask, then the SpO2 levels till 97 are acceptable, and a normal patient should have that. It should not go below that. If it does go below that, then there is some reason. So with a mask and the patient having COPD, then I can understand the levels going down. It's not necessary only COVID-19 might cause that in your patient. So in that case, you might want the patient to remove the mask and then check his SpO2 levels. But that is if you know that this patient is a COPD patient. If the patient is a normal patient, then there's no reason why the SpO2 levels should be going down with a mask on. It should remain normal and should not create any problems. So I hope that answers your question, Irshad, and thank you so many of you all for watching and for your comments and for your likes. I hope this has given you a lot of information. Thank you for watching. Good night and stay safe. Stay home.